I'm Katie Hampton. I am a certified orthopedic specialist and the lead pelvic floor PT at Riverside. The services I offer are very similar to traditional orthopedic physical therapy, but I've had the training to be able to extend that to diagnoses of the pelvic floor. So as far as the type of patients that I see, it's men, women, all ages, all kinds of issues. It can be pain, it can be incontinence, which is leaking stool, urine, or gas. It could be pressure, or it can be people that just haven't responded to treatment with traditional orthopedic physical therapy for back pain, hip pain, knee pain, all sorts of things. People are familiar with how this can be beneficial after pregnancy, surgeries related to bowel, bladder, anything reproductive, but can also be athletes or just people that are interested in getting a little bit more of a full chain kind of approach to things. I think the most rewarding part of my job is when someone comes in and they're a little bit skeptical about what we can do, especially with sensitive things, because nobody wants to be vulnerable and put themselves out there like that. But my favorite thing is just seeing that hope come back for people. So when I get to witness that, that's a huge privilege. The benefits as a patient of coming into a system like Riverside where everything's pretty well integrated. Let's say that you come in after a surgery or you've had a change in medical status, you have a medication question or something like that, and you're coming into physical therapy and that directly has an impact on your plan of care. Instead of us having to wait like a week or 2 weeks or play phone tag for a while, this saves everybody time and it makes your care a little bit safer and more thorough, because you can just send an instant message, you can send an email, you're sharing the same system so you can see all the notes, which could be a really big impact if you've had surgery or something like that. You can get that answer in real time or at least much quicker. We're working on an initiative to start seeing people immediately postpartum. So the idea that our team is open to seeing people a little bit sooner, because you still have to take care of yourself and baby and everyone else in the house a lot of the time. That's a pretty radical thing because a lot of people are afraid to do it, and we have the knowledge and the support to be able to do that here. We are working on classes for cancer rehab, all sorts of things. So I'm really excited to see what happens in the next couple of years, especially as more ideas come to the table.